Many healthcare providers nationwide are prescribing food instead of medicine to tackle the obesity epidemic. Doctors in more than a dozen states are moving away from recommending surgery or pills. Instead, they're giving healthy food to patients struggling with medical issues related to their weight. Jan Crawford is at an urban farm in Washington, D.C., which sends produce to underserved communities. Jan, good morning.
Well, good morning, Jeff. So the produce that's grown here by DC Greens goes to city residents who've been prescribed a healthier diet by their doctors. It is part of this growing trend to help low-income Americans get access to healthier food. And one hospital in central Pennsylvania is taking the effort even further. At Geisinger Hospital in central Pennsylvania, food deliveries start early, turning these medical professionals into temporary grocers.
Once you have the eggs counted, then we should be good.
It's all part of a new fresh food pharmacy, now open in the heart of coal country, where shuttered mines have contributed to high unemployment and rising poverty, making healthy eating a low priority.
And what's your favorite fruit or vegetable that you get from us?
Beans.
The program was created by Dr. Andrea Feinberg, Geisinger's medical director for health and wellness.
We have a higher incidence of obesity, a higher incidence of diabetes, and food insecurity.
And what do you offer them?
So we offer them hope. We're offering a new way to look at diabetes. There are pockets of communities around the United States where the word has not gotten out that food is really medicine.
Started just 9 months ago, the program already serves more than 60 patients and their families, providing healthy food free of charge to more than 200 people each week, along with nutrition classes and cooking advice.
If you're used to eating, pizza and burgers and French fries, and you come in here and there's kale and quinoa, that's a big transition. Do people like it?
So people complain. They're not that excited. First of all, we ask them just to be flexible. Try it. You don't like it? No problem. Come back and tell us. We'll come up with new recipes.
Geisinger is one of the first to set up a standalone pharmacy, but it draws inspiration from more than 70 food prescription programs across the country, all hoping to reverse a frightening trend. More than 100 million Americans are either diabetic or pre-diabetic, and the Centers for Disease Control predicts that by the year 2050, 1 in 3 adults in the U.S. could have diabetes.
We haven't had turkey burger in a while.
Rita Perkins has been diabetic for more than 20 years. After enrolling in the food pharmacy program in March, she cut her blood sugar and cholesterol in half.
You just made yourself some lunch.
Yeah, it's a whole wheat tortilla pizza.
You feel like this program is really making a difference in your life.
It has.
How long do you think you'll stay with it?
Probably for the rest of my life.
Dr. Feinberg says Perkins' results are not unique.
It's over the top successful.
How so?
It's worked for every single patient.
It's worked.
For every single patient.
That's a pretty good success rate.
We're talking about reversing the diabetes, curing the type 2 diabetes, and help the patients move themselves from the sick category to the healthy category.
Now, healthier food like kale and tomatoes, eggplant, that may seem expensive, but Geisinger says that despite providing it all for free, they're actually planning to save money by cutting the long-term medical costs. In fact, the program has been so successful, they're already looking to expand to about a dozen other locations across Pennsylvania and New Jersey. Gayle?
Jan, this is such an important story. People really need to understand the difference that good healthy food can make in your diet. I like the point the doctor made that food is medicine.
Exactly, and that's the program is proving that point. And I think it's also fascinating that despite it may be a little more expensive, they're going to save money in the long run because it's going to cut down on medical costs.
So
kind of attack it at the front end.
Yep.
I hear about this all the time now because Nicole's a nutritionist.
Yeah,
Nicole's
but
yeah.
it takes time. It takes time to get the message across, and I think if you make it the right way, it can taste just as good. The healthy food, as you know, Charlie.
Yes, of course.
The beauty of a Brussels sprout and broccoli. You didn't like it as a kid, but as you get older, you realize it can really taste pretty good.
Yeah. So you're about ready to turn vegan?
No.
Are you doing it?
I'd eat better.
Yes.
No, I'm not going there just yet. Thank you, Jan.